So aged care is the support provided to older Australians in their own home, community or in residential home care. It can include help with everyday living, healthcare, accommodation and equipment such as walking frames or ramps. Government-funded aged care services are available to eligible people. So one of the first things to actually find out is if you're eligible for the aged care support that is offered. So in the main, if you're over 65 or over 50, if you are in Aboriginal or Torres Strait Islander, then you are usually eligible for some sort of form of aged care assistance. Okay, so there's a bit of a journey that has to start at one spot, and that starting point is My Aged Care. My Aged Care, it can be accessed online or it can be accessed through a phone number. That'll be on the next screen. But don't need to make a note of that phone number. I've got some leaflets you can come and pick up which has it in. So there's a number of different types of aged care. You will see the services at the endpoint here. Commonwealth Home Support, home care packages, residential care and residential respite are all available in Esperance. The only ones that aren't available here are transition care and STRC, and I'm not even sure what STRC stands for, I'm sorry. So, in order to access those, you have your registration with My Aged Care by either phoning up their helpline and talking to someone there and actually getting yourself on that first step and saying, I need a bit of help. And it could be a bit of help with mopping the floors, as I heard from someone this morning. It could be that you are no longer able to drive and you'd like some help with transport to your appointments or to the activities you usually undertake. So it can be a variety of things, or it might be to the extent that you are no longer able to shower yourself and you need some assistance with showering, but if you've got that assistance, you can still stay at home, you're still safe. So it can be actually a wide range of different things that you would do. So you can search for My Aged Care online. If you're computer savvy, put My Aged Care into it and it'll bring you up with that page there, which will start you looking at it. But if you're not, the phone number is the way to go. So when you ring up or when you're online, you'll be asked to explain your situation. So eligibility is based on the certain things that we will tell them about. So they'll give you about a 5-minute chat to say, what is it you're looking for? What is it you're feeling you need some assistance with? And why is that? You provide them some details. One of the details you have to provide is your Medicare card. So when you're actually making that phone call, have your Medicare card available to them. You can actually get someone else to help you do that. You don't actually have to do it yourself. If you are in the same room, you can actually say, I would like my daughter, my son, my friend to be my representative, and they will make sure that that is okay with you. They can do that on the phone. They'll speak to one and then they'll speak to the other person. And then once they've spoken to you about all that and said, yes, you are eligible for My Aged Care, I'll set you up with an assessment time. So they will, with those details, they will then get hold of the assessors. This is where it's a bit complex at the moment. At the moment, there are 2 forms of assessment. One form of assessment is for the lower types of care and those people who only need 1 to 3 types of services. There's some pictures a bit later that will make that a little clearer. Those people who are needing something that's maybe a bit more medically, a bit more clinical, as they call it, may have an ACAT assessment. That's someone who needs more care, more assistance, and is likely to need 3 or more types of services from a service provider. The ACAT assessment also assesses for people to go into respite if they need it later, or go into nursing home services. So it's a much fuller assessment that happens. The assessor will have a copy of the information that you gave My Aged Care. They'll know what you talked about on the phone or what you'd put into the form that's online. It'll give them an idea of the type of things that you'll be needing and the type of things that might be available to you. So they'll ask about the support that you already have. What family support do you have? What friends support do you have? And if that's ongoing, or if there's it may be that you've got family who used to help and they're now moving away. So they'll look at your situation. They look at your health, they look at your lifestyle, and they look at your health concerns. So looking at your lifestyle is like, what do you enjoy doing? What can we help you continue to do that is going to keep you independent and at home? How you go about completing daily tasks. Just because you can't mop that floor safely anymore doesn't mean that you can't still do your shopping or you can't still do your cooking and go to the senior sits for the activities you do. So it may be that there's just a little bit of help to keep you going on those things. Are you having problems with memory? I'm always having problems with my memory, particularly when it's someone's name. Are there any issues relating to home or personal safety? So is that step going out the back now something you can't manage to go and put your washing out? So it might be that there's an assessment done so that you can have a ramp put in or smaller steps. Family and community activities, what's going on around the place that you would like to get involved with but you're finding it difficult. And they may get you to speak to your GP and ask some specific questions. So when you've had your assessment, you will receive what they call a support plan, and you'll receive some codes and numbers which allow you to access home care, in-home care from either myself or another organisation. So as I said, aged care programmes are a bit of a continuum. You have your entry-level in-home support, which is called the Commonwealth Health Home Support Programme, or CHSP. Commonly known as. More complex, it's the home care packages and residential care. So our entry level, type of services available for CHSP. So the only ones that aren't available here are the cottage respite, and I think that's it. So everything else is available here. The only one we don't do is the home modifications and maintenance. That is actually referred through the OT's department at the hospital. So we can help with providing social support either individually or in a group. We've got a number of groups that operate at the moment, and we're soon to be moving into our brand new, wonderful looking day centre when it's finally finished. So transport. Transport can be a regular thing. You can have the transport to come here for lunches, perhaps, or a particular group you're undertaking, or it could be that you've got doctor's appointments you need to keep. So we are able to provide transport given notice. There are times when our staff are fully occupied, so ringing up the day before and asking for transport doesn't work quite often because we haven't got any staff members available. So with notice they're always appreciated. Domestic assistance. So the domestic assistance we provide is what we call a hygienic clean. So it's helping you to keep things hygienic in the house. It's not that deep clean that you might get at the end of a rental. It's the hygienic clean. It's keeping things going with you. And it's done for CHSP, it's done in what we call the strengths-based approach. So if you can do it, you do it. If you can't, we do it. So if you can still do the dusting safely because you're able to do that, then we will let you do your dusting and we'll do the other things around it. Personal care, it can be all the way from what we call a standby shower. So that can be, I don't feel safe in the shower at the moment on my own, but if someone's in the house, then I feel I can then go and have my shower. So it can be what we call a standby shower right from that point, all the way up to having someone who's needing to be hoisted and put into a special chair and taken into the shower and actually washed. So that's our high care showers. Flexible respite can be offered at times when we've got enough staff, if it's just a one-off or at various times, and we can assist with things like coming into the home and spending some time with a person. So if you're a carer, so we can come in and spend some time with that person while you go out and do the jobs that you need to do. that can also be counted as social support. Our Meals on Wheels are available, and we have nursing care and allied health therapies. Okay. Complex home care is your HCP packages, home care packages that they do. Very similar to the previous one. They range from social support services, social activities, joining a group, one-on-one support in town, personal care, allied health services, and care coordination and case management is with those. Okay, a little bit about home care packages. Home care packages, people will often come away from an assessment about home care packages and go, oh, I'll get to the right page so I get the right figures on that one. If I'm on a home care package level 2, for instance, there's $18,000 that's available to me per year to actually have some health care. That's what the government puts aside for a level 2 package. And for that level 2 package, that's what we can access as an organisation for your care. It doesn't mean that money is there, so if I don't use the care, I can then have the money in my pocket to buy something else, unfortunately. So, and they are very particular about what things can be bought and what can't. So when we move up to the level 3, your level 3 packages for intermediate care, and that's worth about 8 hours of assistance per week, roughly. It depends on the assistance you're needing, because if it's nursing assistance, it's actually more, it costs more, so it might actually be less hours if it's nursing assistance. And it goes all the way up to level 4, which is around $60,000 of assistance, but that only equates to about 12 hours per week. So you can see even at a level 4 high-level care package, it's not enough to keep someone in their home totally and have someone 24 hours a day assisting to keep someone in their home. That's where the government suggests that you then move on to looking at your residential care. Okay? So, what will home care cost? So whilst it's subsidised by the government, it's not actually totally free. Right? And that actually can be a bit of a surprise to some people, particularly when they hear that this money is available, different bits of money are available. Under CHSP, the government expects that everyone will co-contribute. So there are fees in place for, such as your Meals on Wheels. Meals on Wheels is currently $13 that you contribute to that, because the government feels that you should pay for your food side of it. Everything that's done for in-home care is not about providing an alternative to your income, it's about subsidising the care that you need because of your ageing process. So there is a bill at the end of the month, unfortunately. With a home care package, as I said, there is a certain amount that we're allocated to allow for in the spending and in the care that we organise for you and we organise with you. And given that sometimes people do go over that, and sometimes they don't. The level 3s and level 4s are quite high in terms of, because you may need equipment. So that wheelchair may need to be something that's bought for you or the person you're caring for. Or it may be that you need the hoist, or the Sarah Steady, which helps you get up, stand up and move around. So if you're on a home care package, you actually have to go and have an assessment with Services Australia. CHSP you don't, it's just general, but for a home care package, you actually have to have your income assessed to decide how much your per day contribution will be. And if you're full pensioner, you will not pay anything towards your home care package. If you are fully funded, if you're a fully self-funded retiree, however, your package can cost you up to $35 a day. So that's about $1,000 a month. So when people don't understand that side of it, again, it can be a huge shock. It doesn't matter if you're on level 1 or level 4, you pay the same per day amount for your home care package. So it's really worth having a look at what the costs are for yourself when you're looking about what you need. but please never make the cost stop you going to get that care you need. There are other ways around it. There's always some different ways that we can actually look at to assist you. Okay. There have been lots of aged care reforms over the last 12 months, and one of those is to have Services Australia have some specialist officers to help explain. I'm not going to go through this slide because we don't actually have one. There's only, I think it's 4, there's only 4 throughout WA. They are trying to extend the Services Australia's specialist areas, and hopefully over the next couple of years we'll see in our own DSS office that we would have someone down here. Some of the other reforms that have come into play over the last 12 months have been a new bill which is coming through to give us a new act. That's due in July this year. I don't know if you've seen any of the information around that, about the new act, which will give us some new standards to work to. Yay! Another change of paperwork for us. But it will simplify the assessment system that I was talking about before. So at the moment there's 2, you could either have a RAS assessment or an ACAD assessment. It's going to become a single assessment, and that's coming in July. So if you don't get if you don't get through to doing this process until after July, hopefully there'll be a single assessment and you won't have to have that decision of which one you're going for. So at the moment, we are working under the Commission with 8 standards. That is going to go down to 6 standards shortly. But it's all about being person-centred, and it's all about working with you, not throwing things at you that you may not need. There's a lot of information. There's far too much information in some cases, and it gets very confusing. And if you go through some of the websites, I end up in a bit of a rabbit hole, finding all sorts of different things when I'm looking for it. But there are some general things that are really useful for looking through yourselves, and that is the My Aged Care website. So the My Aged Care website is easy to Google, or you can phone them up on 1800 200 422. Now I think I've rushed through a lot of that. So if there's any questions, please let me know.
I've just been through all this with my mum, and the one thing that I found quite frustrating was I couldn't find her birth certificate, her marriage certificate, and when you upload these documents on the one particular site that I was on, it asked for a birth certificate, so I had to go and order a birth certificate. That was $60, so I ordered the birth certificate, and then it wouldn't let me go any further through the document until I uploaded the birth certificate. So I did that, and then the next question was, after I uploaded it, is this her current name? Well, no, because she got married. I couldn't find a marriage certificate, so then I had to order a marriage certificate, another $60, another 2 weeks to wait. So this particular form was ready to, I was ready to get the computer and chuck it out the window and say, stuff this, is not going to happen. The only other piece of advice I would say also is, if you hand your driver's licence in, you don't have any identification. You can get a photo card, but once again, with this particular website that I was putting it through for the My Aged Care or Centrelink or whatever, Mum had no identification because she'd handed a driver's licence in. The photo card wasn't sufficient enough to have as ID. She didn't have a passport. So you then have to go through Centrelink and do other ways of doing it. So it becomes very frustrating. And I'm not the best computer literate person around, but I can still follow my nose. So that kind of stuff, if you're going to hand your driver's licence in, get all this stuff. I would recommend with the My Aged Care, I've got a My Aged Care number already. So hopefully when my time comes, it's already, Kevin won't have to worry about it. But it becomes very frustrating because you don't have all the documentation. If you don't have all the documentation and you don't have any identification, so get it before you hand your driver's licence in is what I would be saying.
Not so much a question, but like Heather, a bit of handy advice. Dealing with Centrelink, if you're not a pensioner, the complexity of the forms for a home care package or even residential care get more and more complicated. So you probably, if you've got someone who can help you go through that, certainly get them to help you. I don't know if S-Care still helps, does that form filling? Yes, because it's very intense. If you tick some box and go, oh, now you need form XYZ, and then you tick that, oh, and another form, and you don't really have to have too much money in the bank for it to kind of just click over. And then the other thing, I've had the experience recently where I put my forms in on the 7th of September. I went back to our local Centrelink office, which I have to say, if you've dealt with them, they're really, really good. We're so fortunate in Esperance. There's never a line out the door, and it might seem a bit frustrating to sit for 20 minutes, but look, they're a great team in there. So I went back, I think 2 or 3 times to check. Oh, no, they're still assessing it. Oh, there's been floods, in the east, so they take the assessors off. So finally, about 2 weeks ago, I went to Rick Wilson's office, and within 2 weeks, bang. Hello, is that you, Elaine? Yes, this is Services Australia calling. So if it starts to delay, go straight to Rick Wilson's office and they will assist you. And the same with entry into the Esperance Aged Care facility. It's very important, if you're even thinking about going in yourself or a loved one, to start doing your means testing. And regardless, you have to do it whether you're a pensioner or not. Even if you're a pensioner, you still have to fill in the forms. You have to keep skipping, and they're pretty simple. But if you can get all that done before you go in, that's a great benefit to everybody. Mm.
Nellie, did you try an accountant at all?
I had to use an accountant, yeah.
I was going to say, I'm not sure if all accountants do it, but I do know my parents used an accountant to fill in the forms.
I had to, yeah. If you're a self-funded retiree and you have an accountant, I had to get them to fill in that part of the form, definitely, yeah.
Anyone who's been through the process knows that it's a bloody nightmare. And I found this little book, this big book actually. I found this at an expo I went to last year. What was the name of it? I can't remember. It was at the Convention Centre in Perth, a massive big expo, much bigger than this, with all these little stalls. And I found this book, and it's got everything in it. And a lot of it is advertising for Perth-based home care providers like Esperance Home Care is for us. It's got a lot about nursing homes up there which aren't relevant to us. But for family members, it's great just to have on hand. You can see the process, like you're saying, Nellie. It's all set out there. What you do if this doesn't work and all that sort of stuff happens. So, Eric, the people, I got in touch with the publishers, they sent me boxes of them. So Erica's got heaps up there. Even if you don't need it now, just grab one because they're great to have. Sometime we're all going to need it. The ACAT team here in Esperance have given us some localised little kits as well. They couldn't be here, but they've given us kits, and there's these little smaller booklets. When I was in Perth at that expo, all of you will know Jean Kitson. She's an Australian comedian. Oh my God, her parents are going through this whole assessing process, and I bought her book when I got back to Esperance. You can see how much I've used it. Now, she's amazing, and she was saying, when you need to phone my aged care, do it at 8 o'clock in the morning. Arm yourself with a book or a cup of coffee or a glass of wine, she said. And know that you're going to be on the phone for a long time, and know that they're just going to tell you to do something else, and then you've got to go back. And her book is absolutely amazing if you want to read it. If you're going through the process, or you've been through it even, it's really good, and it is available on audio book as well. So it just makes all this stuff much more light-hearted, even though there's a lot of really good resources in there. So there's heaps of information, and honestly, I wouldn't wait. Like Heather said, you get your My Aged Care number, then you've got your foot in the door, and if you don't ever use it, doesn't matter.